10 things you need to know about PrEP.
So, what's PrEP?
PrEP stands for pre-exposure prophylaxis, a pill that's taken every day to prevent HIV.
Does PrEP work?
Studies have shown that if PrEP's taken every day, it reduces your risk of getting HIV by at least 92%.
Before you get started,
Before you start taking PrEP, it's important to check that you don't already have HIV, so you'll need to have an HIV test. Also, because PrEP may affect your kidneys, you'll need a blood test to ensure that they're working well.
what about side effects?
Some people taking PrEP have had mild reactions such as upset stomach, loss of appetite or mild headaches, but these side effects usually go away after the first couple of weeks. If these side effects bother you, have a chat with your doctor. PrEP can affect your kidneys, so it's important to get them checked before you start, and then every 3 months while you're taking the drug. You need to talk to your doctor about bone health, because in some people, PrEP decreases bone strength.
Okay, so how do I get started?
So, once you start taking PrEP, you need to take it for a week before any potential exposure to HIV. If you're a woman or a trans guy, then you'll need to take it for a month before. And remember, PrEP is just one tool to prevent HIV. It can't protect you against any other STI, so it's a good idea to keep condoms in the mix. And be sure to let your doctor know if you've had any recent risk exposure to HIV, because this could change the kind of drugs that are prescribed to get you started.
Right, so what if I want to stop taking PrEP?
If you decide to stop taking PrEP, it's recommended that you continue taking the drug for 28 days after your last potential exposure to HIV.
Taking PrEP every single time.
It's very important that you take your PrEP every day as prescribed. If you only manage to take the drug every now and again, it's not going to give you the best protection against HIV. If you get HIV when you're not taking your PrEP properly, then the HIV you have can become resistant to the drug. That's because the same drug used for PrEP is also one of the drugs used to treat HIV. What that means is that your HIV treatment becomes more complex, limiting your options. So it's best to take PrEP every day. That way you'll avoid HIV altogether. There are a range of things that can help you remember to take your PrEP every day. There are small dosette boxes you can get from the chemist. There are even smartphone apps that'll help remind you as well. The easiest way to remember is to slot it into your daily routine. Put it on your bedside table and take it every morning when you wake up, or when you brush your teeth, or having a morning coffee. Making PrEP part of the things you do every day will mean that it remains effective against HIV. Your doctor will be able to help you out with suggestions if you think you'll have trouble taking a daily pill.
So, remember to check in.
Once you start taking PrEP, you'll need to schedule appointments with your doctor every 3 months for a new prescription and a sexual health check.
It's all about you.
It's important to be really clear with your doctor about why you want PrEP and think about other ways you can avoid STIs. Remember, always get a sexual health check every 3 months, always get your doctor to monitor your kidney health, always take your PrEP every day.
It's all about you taking control.
Stopping HIV one day at a time.